Akmal, a psychiatrist and an author, and today we're talking about psychopathy and psychopathic children. Dr. Akmal, just to begin with, what is psychopathy?
I think that we'll just use a generic concept. Psychopathy is deemed as a maladaptive pattern of living in which a person has no empathy, no conscience, doesn't learn, and is callous about other people. So that's generally the whole concept. Right. Somebody who doesn't care. Mm-hmm. But that, so it has two aspects to it. The individual aspect, the psychopathy within, being callous, being selfish, being, entitled, manipulative in terms of self-gain. And then there is the sociopathy, which then affects other people, being cruel, being, inconsiderate, hurtful, breaching of boundaries, etc., and damaging other people. So somebody who does all that can be considered part of the psychopathic spectrum.
But what is the cause of psychopathy? What is it? Is it something that starts in your childhood, or is it something that your parents have done, or society has done, or that's just innate and intrinsic to your personality?
The main determinant is what kind of a parenting and household that person has. So it is totally paradoxical in the sense that parenting can be excellent, and the child may still have psychopathic traits.
Really?
Yes.
Even if it's been an average
angelic parents, ideal, by the book, by all morals and so on, and it can be there. And that child's behavior then affects parental behavior. Because if the child is destructive and child is creating so much challenge of existence to the well-being of the family, then of course parental attitudes and parental peace and harmony and relationship will be affected. But then there is also the other bit. So that's a kind of a spectrum between nature and nurture. So the other spectrum is that it is bad parenting, which is not allowing the child to mature. So drug addiction, lies, crime, delinquency and behavior, so if psychopathic parenting will of course be a trigger for the child or the model for the child to be psychopathic.
Are you saying that there are those psychopathic adults, for example, who just lead normal lives? They're not into doing anything criminal, etc., etc. They're trying to still fit into society, even though they have those negative traits within them, but they keep them undercover.
Yes, and that is where they're less sociopathic and more psychopathic. So it's like people who torture spouses, who psychopathic abuse. Where their needs are primal, the other needs are none. They lead their lives how they want to. They will deceive, cheat, hide, manipulate, exploit, suppress the other person.
And what about a psychopathic child? That's a big topic at the moment. Lots of parents are concerned they want their children to be very healthy, but there are some who are concerned that their child is either demonstrating Asperger's or a form of autism, and then they're having some sadistic qualities like hurting animals and things like that. What is the situation? When children are getting it at a young age, what should parents do?
I think the most important thing is interest in the child. Obviously, observation of the child, obviously a relationship with the child. When you say that parents are concerned, parents are only concerned when they hear this from the school or when they observe it themselves. There needs to be an observational concern, but there shouldn't be anxiety associated with that.
Some spiritualists and perhaps orthodox religious teachings will say that somebody who is a psychopath or perhaps showing psychopathic traits, it's because their heart is becoming dark or there's some demonic influence that's infiltrating them or affecting them. That's why they're acting out negative and evil actions. What do you think about that?
The thing is that if it is being seen, or it is seen as a temporary demonic possession or temporary darkness, then I would say, okay, that's another construct. Right? So you want to veil the whole behavior in spiritual terminology, great. But if you brand the child as demonic and the religious rituals have resulted in severe trauma to the children, so it is, I think, something that you need to set limits to.
Often religion can be very vague about demonic influence. It doesn't really mention that in many religions, but they can talk about negative energies, and that if we attract negative energies within us, they can then produce negative results. We don't know much. I think there's
these are
clarity.
Exactly because these are parapsychological. There is sort of no real clarity about it. It is part of your own faith and your cultural background, what people come up with and what their scriptural and other sort of ecclesiastical influences suggested. But what I would say is that as far as a mental health professional is concerned, a physician is concerned, or a parent is concerned, you need to be looking at these behaviors and looking at many modalities. So spirituality is one factor available to you to treat with. So if you are demonic yourself and you believe in the ultimate control of the demonic, that once it grabs you, it won't go, then you're psychopathic yourself. So then, of course, there is no treatment. You need to get treatment first before you treat the child as demonic, because the child is probably not demonic.